Our region's business is sponsored by PNC for the achiever in us all, and by Fregasso Financial Advisors. How different could your life be? Fee-based investment management securities offered through LPL Financial, member FINRA SIPC. Our region's business. Innovation, transformation, momentum, improving our communities and driving technologies that will shape our region for generations. The collaboration that brings vitality, prosperity, and life to living. Stay with us for the coming half hour as we examine in depth our region's business. Now, here's your host, Bill Flanagan.
Today on our region's business, making the most of employee benefits and walking the walk when it comes to diversity in the workplace. But first, the health insurance wars. What's at stake for our region in the face-off between Highmark and UPMC Health System? Christine Whipple is Executive Director of the Pittsburgh Business Group on Health, and welcome. Good to have you here.
Thank you, Bill. I'm glad to be here today.
I guess for folks who don't know the Business Group on Health, what are you exactly, or what is it exactly?
Yes, the Pittsburgh Business Group on Health is the employer-led coalition here in Pittsburgh. We are celebrating our 30th anniversary this year, and we have a membership of over 65 organizations, 55 of which are employer members. And we're here representing the employer perspective and interest in health care and the benefits that they provide to their employees and dependents and retirees.
Okay, so you represent the customers of these two big organizations.
As I like to say, we represent the true payers of benefits in the market.
And we've all watched this battle unfold by these two enormous organizations. You're concerned about the way this impasse has developed.
Yes, I think the employers are unsure exactly what's going on here. We can hear and read what's been in the press, but they really do want them, they understand the business perspectives of each one of them, but this is a contract and negotiations should be taking place, and that's what the employers are hoping will happen. If
the impasse remains, I mean, where does it leave your employers and I guess all their employees with a lot of uncertainty?
Well, you know, right now, the contracts are still in place. Employers are evaluating what options and what decisions they need to be made. But for right now, they're wanting the process to play out. And the whole hope is that the two organizations will be back at the table and really working through what their differences are. There's a recognition that they each have their own business perspectives, but also there's a recognition that these are important community assets and valuable to the community and to the employers and to their employees. And they hope that the continued access and availability of all health insurance and all healthcare providers can remain in the marketplace.
Well, we do seem to be in an unusual position, or maybe you could say if we truly are in this region, where we have one organization that controls the majority of the healthcare delivery system, the other organization controls the majority of the insurance policies. And are there other places in the United States that are dealing with a circumstance like this?
Bill, that's a great question, and one that we're also asking and investigating ourselves right now. And it does appear that this is a very unique market with a dominance of a health insurer and the dominance of a provider system. We actually are evaluating, we've commissioned a study to see if in fact we are unique and how unique we are. We don't have those results yet, but we anticipate having them soon, and they'll be presented to my board.
Okay. So how do you think this is going to unfold going forward? Do you have any sense of where we go from here?
Well, again, the employers really do support competition in the marketplace in all aspects, the competition across insurers and competition across providers. And that's what is the hope, is that remains, and we have access to quality, affordable health care. It's interesting, I think that for me personally, this situation has made me stop and think about some of the community resources that we have. We have excellent health care in this market, in this region. And how is that, what is the best way to make sure those significant healthcare resources are available to everyone, regardless of the insurance plan that you're under, or regardless of what perhaps your physician system, the system that the physician might be associated with. But there are important services that should be available to everyone in the community, regardless of where you fall as far as your insurance or your provider is concerned. And I think Children's is one of those assets which has always been available to the citizenry, the community at large, to every insurer on equitable footing. And I think that's what we really need to be striving for.
You look at some of the specialty hospitals, Children's, you look at McGee, I mean, some of the ones that have become associated, and that was a concern raised at the time that they became part of the UPMC system.
That's right, and I think that is a real concern on the part of the employers, is to be able to assure their employees that the relationships that they've had with their physicians will be maintained. People who are in courses of treatment will continue that treatment no matter what happens moving forward, and certainly at an affordable rate. I
remember seeing, I guess it was a quote from one of your board members saying to Highmark, and you just get back to the table, right? Is that basically the message you're sending?
It is. The employers do expect them to be professional in recognizing what role they're playing in the marketplace as far as this issue is concerned. But it's mostly about the health care that is needed by the people in the community.
And are you hearing from the employees of all these employers?
They are. They're calling their employers and saying, you know, what's going on? What should we be doing? What should we be thinking? For a number of my employers, they have multiple year strategies. So they've got a strategy in place for next year and even in another couple years out. So they're staying pat until really this all, the process all plays out.
Wow. Well, a lot to keep an eye on. Certainly, as you say, it could be unique and unprecedented in terms of how this unfolds here in our region. Christine Whipple from the Pittsburgh Business Group on Health. Thank you so much.
Thank you.
Next up, making the most of employee benefits, especially to deal with the cost of health care in retirement. Stay with us.